let's go ahead and get started. As people roll in, we will just let them in and filter them in. Welcome back to installment 2 of the free pelvic health webinar that Centrality is hosting. My name is Jen Morgan. I own Centrality Wellness, and we are super excited to bring this pelvic health webinar all about endometriosis to you all. And we have 2 dope, really amazing providers and advocates who are going to speak to you guys today, Janelle and Kailey, and I'm going to let them take it away. Couple of housekeeping things though before we start. Please mute yourself so that we don't have any background noise. If you have any questions, please put them in the chat. We'll make sure they all get answered at the end. And then you will also get a recording of this call tomorrow morning in full. So keep an eye out for that, as well as some resources that Kailey is going to share too. With that being said, I'm going to go ahead and click forward. Janelle, take it away.
Okay, perfect. Thank you so much for being here with us. I'm Janelle. So I'm a doctor of physical therapy. I'm a pelvic health specialist, and I treat pediatric to adults. I have training in pregnancy and postpartum, as well as pediatric and adults pelvic health. I also have been trained in visceral manipulations, as well as a functional nutrition certificate. So I focus on treating patients with a holistic approach. And then we're going to hear from Kailey, who is my co-host, and she is a endometriosis warrior and a big advocate for it.
Yeah, so hey guys, my name's Kailey. I live in Connecticut. I'm an endometriosis patient, pelvic floor PT patient, and an advocate. I do have a business, and I'm a certified fitness instructor with training in therapeutic recreation. I was diagnosed in 2016, and I will tell you more about that later on in our presentation. And my mission is just to provide those endometriosis with education, support, and resources, and kind of just build a little community to make everyone feel accepted and welcomed. And yeah, so back to Jen.
Okay, perfect. So here's what we're going to learn in this presentation. We're going to kind of learn what is endometriosis, how does it present, how can we build a team and to get the best support and treatment, what is pelvic health physical therapy and how can it help endometriosis. We're going to look at a holistic approach to endometriosis, and then we're going to hear resources and support, as well as Kailey's story. Let's start with what is endometriosis. So endometriosis is the presence of endometrial tissue located outside of the uterus. So this tissue is similar to endometrial tissue. However, they have found that it's more fibrous and it tends to have more cysts. Now, these implants do respond to hormones, just like in your typical cycle. So when you have your cycle and you bleed, these tissues actually do bleed as well, except unlike the tissue that's located in the uterus, this tissue doesn't have anywhere to go. And so the blood kind of gets trapped. And what happens is it ends up causing irritation and inflammation. And this can result in scar tissue and adhesions over time. This is a disease that responds to hormones, specifically estrogen. So it is an estrogen dependent hormone. And, we end up having things like pain, infertility. It can affect multiple organs. So it doesn't just stay in the pelvis. It can do bladder, bowels. They've even found it in the diaphragm and it really all over the body. So endometriosis is actually fairly common. There's 1 in 10 people with a uterus have this, which around 200 million people worldwide living with this condition. The number 1 reported symptom is going to be pain, usually pelvic pain, but that can look like period pain. It can look like pain with sex, pain with ovulation, urination, and bowel movements. It's a chronic condition that impacts people at any age, race, or gender. It's very complex and it is difficult to diagnose, and the delay in diagnosis usually ranges from 7 to 10 years. So it can be really debilitating for these patients, as they usually been to multiple doctors trying to figure out what's going on, and it can really take a long time to get there. It's commonly misdiagnosed as IBS or interstitial cystitis. So again, you're going to see a lot of involvement with the bowels and bladder, and that's sometimes how it presents with people, and it's commonly misdiagnosed as that. The disease can be divided into 3 different subtypes. So you can have superficial peritoneal endometriosis. So that's going to be, it's a minimal form. It's just the membranes that line the abdomen that are infiltrated. You have ovarian, and that's going to be with the ovaries are going to have cysts on them. And these cysts can actually break open and spread the endometriosis into the pelvic cavity. And then we have deep infiltrating endometriosis. And this is where it involves organs within the pelvic cavity. Within this subset, we can also divide it into stages between 1 to 4. 1 is the least minimal, so with very few implants, going to stage 4, which is going to be have many deep implants. It's also going to involve the ovaries in the abdomen. Now, 20 to 25% of women actually have no symptoms. And then on the next slide, we're going to go into what it can look like. So signs of endometriosis, there are lots of different signs. Like we said, the #1 symptom is going to be pelvic pain. It can also have painful sex. You can have bladder and pain and dysfunction, painful bowel movements. It can look like back pain, leg pain, bloating, fatigue, infertility. And then a really big one is debilitating periods. And this is more than just a cramp at your period. This is people are actually missing school or work or social activities, and they actually need to stay in and rest and deal with the pain during their periods. Some less common symptoms that can arise are coughing up blood or lung collapse with your period. You can also get pain with breathing or shoulder pain during your periods. Now, these symptoms can occur anytime in the cycle, not just during menstruation. It's also important to note that this can occur post-menopausal and post a hysterectomy. Common myths of endometriosis. So one of them, a big one, is that it's just a heavy period. I know a lot of women are told this when they visit their gynecologist. It always causes infertility. That's absolutely not true. There are plenty of women who are able to have babies while they have endometriosis. Endometriosis only affects the pelvic region. As we kind of said before, this can affect many areas of the body, and it's not just contained in the pelvis. It can be prevented, and it always improves after menopause, which, our bodies are still producing small amounts of estrogen. So although people's symptoms may improve, it's not necessarily going to go away. And there's been plenty of studies that show women actually still have endometriosis after menopause. The cause remains unknown of endometriosis. There's been a lot of research out there, which there can find some correlations. Some of those are retrograde menstruation, which is basically a reverse menstrual blood, so when the blood doesn't flow out of the cervix, but it's pushed backwards out of the uterus back into the fallopian tubes. Now, they've actually found this, and it's actually not super uncommon. So they find women who don't have endometriosis also have the retrograde menstruation. So it's not, necessarily you're going to have it. There's been some link with hormonal imbalances. So, we know that this disease is estrogen dependent. So they're looking at things like estrogen dominance, where people have a really high level of estrogen. And things, from our environment can even cause this, such as endocrine disruptors, hormones, toxins, environmental toxins that we're exposed to daily have been linked to affecting our estrogen. There has been a link to autoimmune conditions. So they have found in the tissue that there's actually tissue-specific antibodies and cytokines involved. So this is letting us know that the immune system is somewhat involved. And there's also been a link with our gut health. So a lot of our hormones and neurotransmitters are actually made in our gut. And this can affect how our hormones are made and lead to a hormonal imbalance. We also has been found research about leaky gut, which is a leakage of things that should be inside of your gut to the outside of your gut, which can cause a systemic inflammation. So this is a very complex condition. So it's going to do best with having a team approach, and you want to build a team with providers who are going to listen and support. Like I mentioned before, it takes years of going to doctors for these people to finally get a diagnosis and to be heard. So really the best thing you can do is provide an ear to listen and give them support and believe what they're telling you. For treatment, we're going to combine things like surgeries, medications, natural therapies. That's going to look like pelvic health therapy. We can look at diet and nutrition. We can look at an emotional aspect and providing them with therapy. It's also important to get some lab testing. It's great to look at hormone levels and see where are these hormones, how do they fluctuate throughout a cycle, and to look at their gut health as well. So this is just some providers who should be on your team, right? You want to have a surgeon who specializes in endometriosis. You also want to have an OBGYN who is knowledgeable about endometriosis. Not all surgeons and OBGYNs are created equal when it comes to endometriosis. So you want to make sure these people have the knowledge and the clinical expertise to help you with this condition. A pelvic floor physical therapist, they should also be versed with endometriosis. A GI doctor, urologist for the bladder, pain management doctor, a nutritionist, a therapist, and a peer support system are all going to be really important people to have on your team. So how does pelvic floor physical therapy relate to endometriosis? So how we're going to help is we're going to manage symptoms and pain associated with endometriosis. We are not going to cure endometriosis, but we're going to help the symptoms and help these people manage just the pain and issues that they're having through the pelvic region. We can break it down into kind of 3 different systems: musculoskeletal and myofascial system. So that's going to address things like the muscles, the fascia, and we're going to go into details into each of these. We're also going to address bladder, bowel, and sexual function, and the nervous system. And so we really treat the body as a whole, and we're going to address the associated functional impairments and the symptoms. You may come to us with pelvic pain, but we're going to look at how does this affect your posture and your core and your hip movements. We're really going to treat the body as a whole. Just a brief overview in case you missed the last mini webinar that we did. What is pelvic floor and what is pelvic floor therapy? So your pelvic floor is made up of 3 layers. There's muscle, ligaments, and connective tissue. They form a supportive sling at the base of the pelvis. So they go from pubic bone to tailbone and then from side to side between the hips. These muscles are going to be responsible for supporting our organs. So they support the bladder, the rectum, and the uterus. And they also are going to play a role in controlling the bladder, bowels, and sexual function. They're also going to provide stability to the spine and the pelvis, and they're going to help us maintain posture and balance. And they're going to work in coordination with the diaphragm, and they're going to help us manage pressure within the abdominal cavity. So some of the impairments that you might see with endometriosis, we're going to look for areas of muscle tightness and pain, and that's usually going to be somewhere around the pelvis, the pelvic floor, the abdomen, and the back. This chronic pain can also affect posture, muscle tone, and alignment. So we're going to make sure, like I said, we're going to address the body as a whole. We're going to look at how are they holding their body? Are they guarding because of the pain? We're going to look at pelvic floor muscle dysfunction. So that's going to be, tightness in the pelvic floor muscles as well as weakness. And a lot of these patients do have the inability to completely relax. So they have difficulty being able to relax these muscles as well as with the coordination of these muscles. We're also going to find a lot of scar tissue and adhesions. Like I mentioned, this is common from the bleeding of the tissue. We can also get scar tissue and adhesions after surgery as well. We're going to address any dysfunction with the bladder. So for some people, that looks like interstitial cystitis, an overactive bladder. Some people, it's incomplete emptying. So, a lot of times we'll see urgency with bladder. We're going to see, you could see leakage if we have some weakness in the pelvic floor. It's also very common to find dysfunction with bowels. So IBS is a common condition that is diagnosed with endometriosis. We can also have something called endobelly, which is a lot of bloating and really uncomfortable for these patients. Constipation is not uncommon, as well as fecal incontinence. And then we also have dyspareunia, which is painful sex. So when we look at addressing the musculoskeletal system, what that's going to look like with pelvic floor physical therapy, we're going to address myofascial trigger points, release, and manual therapy. So sometimes that is within the pelvic floor, so that would be with internal work, but we're also going to look at the muscles surrounding the pelvis, the back, the hips, and the abdominal cavity. So a lot of these muscles, because they're in pain and guarding, there's going to be a lot of tension and tightness in these muscles. We're also going to look at the mobility of these muscles around the areas I just spoke about. So, because of the guarding, we're going to have tightness. So we want to make sure that these joints and muscles can move freely and there's no tightness. We want to look at the strength of the muscles surrounding the hips and pelvis. We need support internally with our pelvic floor, as well as externally around the pelvis, to give us stability and to prevent any kind of pain, and to be able to do our normal ADLs in day-to-day lives. It's also going to look like movement and exercise. So therapeutic exercise has been found to be one of the best non-drug treatments, and they've really done a lot of studies where 6 to 8 weeks of some sort of therapeutic exercise program significantly decreases pain and increases quality of life for patients with endometriosis. We're also going to address posture, biomechanics, and ADL. So that's going to look like, if you're a mom, how am I lifting up my kiddos? If you are working, like, what are you doing at your desk? How are you sitting all day? How are you doing your activities of daily life? Because it's really important for us to improve the quality of their life. So bladder, bowels, and sexual functions. What that's going to look like is optimized bladder and bowel health. So, we're going to build a really great bladder and bowel health routine. And we're going to do that through behavior and lifestyle modifications. So we're going to put you probably on some sort of bowel routine. We're going to look at the mechanics of going to the bathroom. What does that look like? What does it look like to drink proper fluids and hydrate our system? And do we need to add any supplements to help us? How can we optimize the bladder and bowel health so that these function right? They really affect our pelvic floor and just our quality of life. We're also going to address any dysfunction and pain. So whether that's constipation, the overactive bladder, the urgency, in this area, it's a lot of behavior and lifestyle modifications that we're going to do. As well as just addressing any kind of dysfunction around here. We're also going to optimize pressure regulation within the core. And so this is really important for our pelvic floor when you think about holding our breath. So we work a lot on diaphragmatic breathing, which is key to regulating this pressure within our core canister. So the nervous system. So typically these patients that come to you, they have an upregulated nervous system, and sometimes this is categorized as central sensitization. So these patients are more sensitive to stimuli that other people wouldn't be. And kind of here you're going to find that a less is more is the best approach with them. We're going to start really slowly, and for some it may be that just simply the touch of your hand on their abdominal cavity is too much. Our goal is to minimize trauma and to ease in with these patients. This is a great area for us also to talk about visceral manual therapy. And so what this does is it addresses the fascia surrounding the organs. And when this fascia gets, restricted or tight, it actually restricts movements of the organs. And there's a really big correlation with the nervous system here. We're also going to help them build positive self-care strategies. So, endometriosis is a chronic condition. It's not something that is necessarily going to go away, and it's very typical for these patients to have flare-ups. So we want to be able to put into place some strategies so that when they're at home, they can help manage the pain and they can take care of themselves, right? Because they're not going to be with us all the time, and we want to make sure that they have the tools and resources they need to take care of themselves when they're at home. So this could look like creating a really slow movement. It could be How can they distress? It could be having modalities at home, such as a wand or dilator, or doing something like a heat pack in tins to help when the pain gets really bad. When should you go to pelvic floor physical therapy? Anytime that you're experiencing pain, especially in the pelvis, back, abdomen, and especially when it starts to interfere with your daily life. If you're finding any dysfunction with your bladder, bowels, or sexual function. And then also it's great to see us when you're doing pre and post-op surgery. And we're going to get into that more in the next slide. Perfect. So before surgery, if you come to us, we're going to address the trigger points, right? The myofascial kind of pain and trigger points that we talked about. We're going to address any muscular tightness. We're going to optimize the bladder and bowel health. And then we also want to address any pain. Post-operatively, this is usually somewhere 2 to 4 weeks after surgery. And this surgery is just for excision surgery. If it's a hysterectomy, that's going to be a little bit later, or any sort of like bowel resection, that's going to be more like 6 to 8 weeks. We're going to help them with managing pain. That's a really big one right off. And we also want to reduce any adhesions, right? Because most of the times they're getting excision of these sites, and there were usually adhesions if it's on the bladder, the bowels, the pelvis. So this is where that visceral manipulation can really come in hand to prevent some of those adhesions from forming. We're going to help with the scar tissue. So we want to make sure that the scar tissue is healing well and it's mobile and it's not adhesing to any tissue below it. We're going to look at muscle function. And this is slowly, right? You know, these patients in the first 2 to 4 weeks, they aren't lifting anything heavy over about 8 pounds. They're not doing an extreme amount of exercise, and they're taking it pretty easy. So we're going to slowly get them back to muscle function. And we're also going to work on that pressure management within the core canister. What should you expect for physical therapy? So the first session is a pretty in-depth conversation where we're going to talk all things bladder, bowel, sexual health. We want to know, what have you tried? What haven't you tried? What's worked for you? And we do just a really deep dive into your medical history. We're going to look at movements of your hips and back and abdomen. We're also going to explain to you the pelvic anatomy and the pelvic floor. So really big on what we do is patient education, because we want our patients to be empowered and to know, you know, what's going on and all the different parts. So this can include an internal pelvic exam, and it's not mandatory at all. But it does give us a really good idea of any muscular tightness, discoordination, weakness, things that we need to work on. We're going to look at your strength, mobility, flexibility. We're also going to assess your posture. And the length and frequency can vary greatly from person to person, depending on how long they've had the condition, you know, how many organs and areas are involved, you know, if we're pre or post-op in surgery. I will also say that you do no longer need a referral to come see us. You know, some insurances require that to get reimbursement, but you know, you're free to come to pelvic floor physical therapy without a referral from a doctor. This is a great resource on how to find a pelvic floor physical therapist. So there's 3 really great links right here. You can go on, type in your, you know, zip code and find a practitioner. Some of them also provide the training that they've had. You want to see that they have been trained from reliable sources. And so this is a really great way for you to find a pelvic floor physical therapy. Also, sometimes your OBGYNs could have great resources as well. Real quick, I just want to talk about a holistic approach. You know, they know that endometriosis is an inflammatory condition, so there are other ways that we can address this inflammation that can make a difference in the endometriosis. It's obviously not going to get rid of it or solve all the issues, but you know, any little thing that you can do can help. So talking about an anti-inflammatory diet, we want to include things like turmeric and ginger and garlic. Cruciferous vegetables are really going to help with our hormone balance. And gut healing foods, that's going to be fermented foods and leafy greens. You want to involve like high quality protein from different sources. It can be plant-based or animal-based. You want to eat foods that are rich in omega-3 fats. So that's like olive oil, avocado, fish, nuts, and seeds. You want to eat a variety of colors. So, you know, the more you can eat the rainbow when you look at your plate, the more polyphenols you're going to get to your body and the more nutrients you're going to have. And you want to make sure that you're eating fiber-rich foods for nutrients. Fiber is going to help feed our gut bacteria. It's also going to help, again, get rid of some of that excess estrogen that we may have. They have found several foods to, you know, not be helpful for endometriosis. It doesn't mean you have to avoid them at all times, but just to give you an idea, that's alcohol, caffeine, highly processed foods, fried and fast foods, sugar, and red meat. Interesting enough, there's been quite a few studies that have linked an increase in endometriosis symptoms with the consumption of red meat. It's also really great to look at all the aspects of our health. And so, you know, stress reduction, they have found that stress definitely makes pain worse, and it can lead to a hormonal imbalance. So anything you can do to help address your stress, and for everybody, that's going to be unique and individual, right? So if for you that you're going to, you know, you need to do some sort of meditation, gratitude, go work with a therapist, you know, anything that is going to reduce your stress, because in reality, we're never going to get rid of our stress, but we need to learn how to manage it in our day-to-day lives. Exercise, right? So moving the body, which we kind of address in the pelvic floor physical therapy, but also gentle things like walking and yoga and Pilates. Anytime that we can move our bodies, that can also help regulate our hormones. And the emotional aspect. So that's going to look like, you know, body work, therapists, self-care, and reflection. They have definitely found an emotional involvement in endometriosis, and working with a therapist can really great, especially if there's some sort of underlying trauma contributing to the disease. Okay, and Kailey is going to take over, and she is going to tell us a little bit about her journey with endometriosis and share some really great resources that she has for everybody.
Yes, thank you so much, Janelle. That was amazing presentation. So again, my name is Kailey. I'm an endometriosis patient, and I'm just going to share with you a little bit about my journey and how I got to where I am today. I was diagnosed with endo, I guess we'll start there, in 2016. My periods started when I was 11. And they were always, you know, pretty painful, pretty heavy, but the disease runs in my family. Unfortunately, I was the first to be diagnosed, so we didn't really know. We thought, you know, this is how periods are supposed to be. You're supposed to be in bed, you're supposed to have bad cramps, so on and so on. So my symptoms started getting severe when I turned 21, 22, around there. I was in school at the time. I started to miss class a lot. I started to be a really frequent visitor at the ER, sometimes more than once a month, with pelvic pain. It also presented as sciatica for me. So it was pelvic pain, hip pain, sciatica, and pain in my foot. And the symptoms I had were really GI related at first. So we focused on the GI aspect of it. We weren't really thinking about the endometriosis part, you know, when I was 22, 23, or the pelvic pain issues. So I was diagnosed with IBS, and I went through the ringer. We tested for like celiac disease, Crohn's disease, all these other things that could be GI related. And then I just went for a few years, just back and forth to the ER with this pain. Eventually in 2016, at that time I was 26, is when the first time I heard the word endometriosis, and it was actually from a new GI doctor that I started seeing. At that point, I went to my OBGYN. We did the exploratory laparoscopy, and sure enough, I had endometriosis. So we kind of connected that my GI symptoms were more so related to the endometriosis growing. That was my first surgery. And then we tried many hormonal medications, GNHR, agonists, antagonists, and I went down that whole route, and nothing really seemed to help my pain. So I was referred to a reproductive endocrinologist. This is 2019 now, and I had another surgery to remove some of the endo. And again, my pain really didn't get that much better. At that point, I was looking at like complementary therapies. I started exercising more, which did make a good improvement in terms of my mobility and my capabilities. But I was missing a lot of work. I actually had to leave my job that I was at, and that's when I started working for myself full time, just because I called out of work so much and I just felt so guilty about it. So there's that. And fast forward, so to now, I'm 6 weeks roundabout post-op. So I just traveled to New York to have my third surgery, which was excision with an endometriosis specialist. It was also found that I had adenomyosis, which is, it could sometimes be related to endometriosis. It's basically the same kind of endometrial implants inside the muscle layer of the uterus. So I had hysterectomy as well. That's a cure for that. And yeah, so despite all of this, what you're seeing now on the screen, I was still able, to go out and live my life a bit. I like to go paddle boarding, gardening. We took a few trips in between. I did have a hula hoop business for a few years that I really enjoyed doing. When I couldn't do that anymore because of the endo, I switched gears and I became a stretch instructor, similar to yoga, but more so geared towards stretching. And that's where I'm at now. I'm also, so in terms of resources, there's a lot going on in Connecticut. There wasn't a support group, so I decided to make one. It's the Connecticut Endometriosis Support Group, and we're on Facebook, and you can find it on my website as well. And that's for, people with endometriosis, people that think they may have endometriosis, or even caregivers, friends, anyone that wants to learn about it, all are welcome. Also in Connecticut, there's the Endometriosis Working Group. It's the first in the US. So a working group is basically a group of people with an interest in endometriosis, in our case, but it's a legislative group. So we basically meet once a month, and we work on like policy reform, recommending policies, trying to get bills passed, on the state level, and the national level. So if you would like to be involved with that, please let me know. It's composed of, policymakers, physicians, nurses, PTs, educators, and patients. So really anyone that wants to become involved. We're hoping to make it a model for the rest of the country to follow. So if you'd want to get involved, you can contact State Rep Jillian Gilchrist, who heads it. She's a state rep for the district in West Hartford, and you can contact her assistant. That's her email there. And then I have a few more resources for you as well to check out. So these are just some resources, education for endometriosis. A big one is the Center for Endometriosis Care that's located in Atlanta. They have a lot of great factual information on their website. You can check them out. The Endometriosis Summit on YouTube. So if you like watching videos, if that's your thing, you can check out them there. It's Dr. Vidali that runs it, and his partner, who is also a pelvic floor PT. Nancy's Nook is another great resource. Nancy is a retired RN. She used to work with Dr. David Redwine, who is one of the, I would say like the top, what's the word I'm looking for? Like one of the originating founders of endometriosis research. So it's Dr. David Redwine, and Nancy runs that. Extra Pelvic Not Rare is run by Dr. Wendy, and she focuses on endometriosis outside of the pelvis, and just promoting that information out there. And then last but not least, in 16 Years podcast, it's run by Amy, and she is a fantastic resource. She hosts all types of professionals and experts in the field. So there's something for everyone there. If you like to read, you have that. If you like YouTube, you got your videos. And if you like to listen to podcasts, there it is.
That's amazing. Kailey, it's just amazing to hear your story and also to have all these resources. I already have a handful of questions from people not in Connecticut that want to pick your brain a little bit. So before we kind of progress to this last slide, is it okay if I just ask you some of the questions?
Yeah, go for it.
So first and foremost, how did you find a provider that actually listened to you? This individual gave a little background saying that they feel they may have endo and they've gone through a handful of providers and they're really struggling to find someone who either understands the diagnosis or someone who is able to like really ingrain the information that they're trying to tell them. So like, what would you say to somebody who's like on the hunt for a good provider?
That's a fantastic question. So it might take going through a few OBGYNs would be your first start. In the beginning, I went through 4 or 5 before I found the right one. The resources I mentioned there, Nancy's Nook has a very good document, and it's actually relating right to that. So direct questions you can ask your doctor to know if they know about endometriosis. Because I would tell you there are a lot of like misinformation and advice I got before I was diagnosed, and they were red flags. Things like having a baby will cure endo. It's all in your head, you're making it up. That's something I heard. Eating broccoli causes it. Yeah, that was.
Oh, that's an interesting one.
It was. But yeah, so I would say, your first start would just be, Googling it, OBGYNs, endometriosis in your area. Maybe you'll get some hits on the website. Some of them put it on the website that they, specialize in endo or they have an interest in endo. And then I would recommend checking out Nancy's Nook, going through those. It's probably like 12 or 15 questions. I know we don't have time to cover them all right now, but they are on there, and that would be your best bet. Also asking if you do have a pelvic floor PT already, asking your pelvic floor PT, because they are an amazing resource when it comes to endometriosis.
Cool. I love that. And you actually answered somebody else's question, which was, do you have any screening questions that you would ask the provider? So you said Nancy's Nook has a list of questions that someone can like literally print out and just start screening their physicians to see if they would be a good fit.
Exactly. There's a lot that goes into it. You could just ask them, like, do you know about endometriosis? What endometriosis is? How many patients do you have that treat endometriosis? And the list goes on. And don't be afraid. Don't be afraid to sit there and ask those questions, because that's another really hard thing for us as patients. I know I get nervous just from all the, stuff I went through, going through many doctors not believing me, and things like that. So I'll actually print out that list and I will have it right in front of me, right in my hand, and I will read right off of it, like right in front of the doctor. Like, that's another thing. Just don't be afraid. You have to advocate for yourself. And if that means, bringing a friend or a family member with you, I know a lot of girls, and this is sad to say, but if you bring a male, a lot of times the doctors will treat you a little differently. They are most likely not going to say it's all in your head if you have a male with you. Why? I don't know.
Yeah. Navigating medicine is really, really hard. Like navigating medicine is really, really hard.
It is.
I mentioned this at the beginning of the talk, but if you guys have questions, please drop them in the chat. I'm already starting to read off some of the ones that we have. Janelle, this next one is for you. It kind of actually built off of the question that was for Kailey. This person asked, how do I know if a pelvic health physical therapist is for me? Like, how do I screen them if I'm reading their bio online? Like, how do I know they're a good fit?
Yeah, very similar. Don't be afraid to ask questions and try. Somebody might not be a good fit for you, and that's okay to say that and to find somebody else. Check out where their training is from. Like I said, there's going to be some institutions that are really recommended and come highly rated, as far as physical therapy. ask them if they treat. We have patients call all the time and say, are you familiar with endometriosis and can you treat it? And we are, and we will tell them that. And hopefully people will be honest and tell you. You also will probably get a pretty good feel the first time you meet them if they don't seem to have a lot of knowledge about it. So I think definitely asking the questions and just advocating for yourself and kind of looking at some of their background knowledge and who they treat. And also I think people are going to give you recommendations for your pelvic floor physical therapist. So a lot of times it's patients that have been treated by them as well. So ask around in your support groups if they have anybody that you like to.
Totally. I love that answer. I think the other thing I would add is that social media is a gift these days in some ways, and in other ways it can be very overwhelming. However, if you follow a handful of pelvic health therapists on social media, so TikTok or on Instagram, it's not really a large community. I think I could probably list at least somebody that I know very well in every single state. So if I don't know a doctor that could be a good fit for you in Colorado, I'm going to reach out to my friend Christina, who lives in Colorado and she's a public health therapist in Colorado. So don't be afraid to DM somebody on social media. I get DMs all the time and it's like random questions like, hey, do you know somebody here? And I'm like, I do, great. Or if I don't, I'm like, I'll find someone who does. I'll connect you. It's a beautiful way that we can all be connected in that regard. And that goes for surgeons, OBGYN, pelvic health therapists, like whatever feels good. Don't be afraid to do a little digging and use social media for good. Because we know social media can balance out that way. Okay.
That's a really good point, just to add really quickly. Like on Facebook, there's a ton of endometriosis support groups, and you can also search if there's one in your state or your county. And that's a really, really good way to find a doctor who is knowledgeable from other patients.
Totally. Now, Kailey, can anyone join the Connecticut groups? Like, is that something that is possible? Like if they live in like, I don't know, California, like, can they join your support group? Are they able to also be part of some of those things?
Yeah, definitely. We're open to everybody and everybody, even though like I say Connecticut support group, we have girls from all over the country, really, even. So yeah, for sure. Whoever wants to join, all are welcome.
Was it also hard to team up with the legislator to get your working group situated?
Well, the working group came about first. It was established in 2021.
Okay.
So Jill spearheaded that, and so anyone can join. I joined in the beginning of 2022, and it's hard. It's very hard to get bills passed. So we have, I think right now we have 12 or 15 priorities. Each priority hopefully will one day, form into a bill and ideally get passed. So far we passed one bill, and there's one bill currently in the House. So it's going to vote in the Senate. If you would like to participate, which anybody can, sending a letter to your state rep or state senator. I have a whole sample format I could give to you. All you have to do is send a letter, and that will help to promote the bill and get it pushed through. So hopefully we can make change there. I think one of the biggest things we can do is push for policy, because policy is going to give us more, funding for research. It's going to provide, hopefully down the road, like more treatment options, to reduce the diagnostic delay. And that's another aspect that's very important in the world of endometriosis.
Totally. Kailey, send me that. I'll put that in our newsletter, and I'll also put that in the follow-up that's going to come out with this recording, so that if people want to partake in that, that would be amazing. I know I'm going to do that, because policy leads to progress, right? And as we know, and a lot of people learn in pelvic health therapy, the medicine, the testing, the diagnostic is like 10 years behind the clinical presentation of the people that we're working with. It takes time to study, and it takes time to, formulate the best practice for a diagnosis, but the diagnosis has to come first. So everything that we can do to move the needle forward is super incredibly important. The last question I have here is actually for Janelle. Janelle, oh, maybe not the last question, but Janelle, do you use a speculum with your internal assessment? Because speculums make me cringe. That's the question. I think it's a great question because I feel the same.
That is a great question. They make us cringe as well, and we do not use a speculum. We just go in with one finger width, okay, and we'll check the pelvic floor. So like I said, we do a lot of education, and we are going to talk you through what it's going to look like before we do it, and always ask permission. And it is not always necessary. You can say no, there's plenty we can work on without it. It just gives us a really good insight of what's going on internally.
In the chat, Alyssa mentioned how Jill Gilchrist is amazing. She was a keynote speaker at the Endo Summit this year. The Endo Summit, I believe, happens in March. Kailey, correct me if I'm wrong. Is it March? Is that when that typically happens for most people?
Yep, it's usually at the end of March. They've been moving it around these last few years, but it's been in outside of Orlando is where they have it. And Dr. Andrea Vidali and Sally Sorrell, who is his partner, who's a PT, they organize it. It's a huge event, probably the biggest one in the endo world.
I was gonna say it is pretty big. It's pretty big. Sally is a huge resource too. I'll also, we're gonna link these resources. Kailey actually gave me the hyperlinks that will go in the email follow-up tomorrow. I'll also link Sally's Instagram because she's a wealth of knowledge. So we'll link her too. And then another question in the chat, I have been found to have leukocytes in my urine despite not having bacteria present. Could endo be a cause? I'm gonna let you two take that.
She said she has what in the urine? Sorry.
Leukocytes in her urine, right? No bacteria present. So DIP is negative for bacteria.
Okay, so just in my head, that makes me think of like interstitial cystitis. So I don't know if you have any sort of irritation of the bladder, if you have urgency. So we're going to kind of look more at like bladder health. I know sometimes also they'll find protein in the urine with interstitial cystitis. It's white blood cells in the urine. It could be a sign of endo, but Kailey, did you have anything like that with yours? I know because you have some bladder things.
Yeah, I never had experience with that in the bladder. I've had like traces of blood before.
Yeah,
but not for me. But everyone's different,
Yeah, so I would just kind of look at that. And what are the other symptoms that you're having, right? What does your cycle look like? What is your pain levels during your cycle? Do you have pelvic pain? If that's the only symptom you're having, it's not super uncommon to just have some white blood cells. It could be, an older infection. It could be some inflammation you're having, in the bladder or the urinary tract system. But like I said, if there's other symptoms presenting, I would definitely get it checked out.
Yeah, 100%. And I would say even also working with a pelvic health therapist to rule out what we consider like the quote unquote, like dietary or even behavioral modification. So looking at like our bladder function and also gut function, because that also plays a huge role. I think it's a great question though. And that's definitely something you'd want to dig into to kind of figure out like what's going on. Let's see here. Oh yeah, so secondary to that is that there's also some pelvic pain as well. So definitely find a pelvic health therapist. You got enough of the boxes that we're checking that I think starting to build your team is going to be a smart move. So we back you on that for sure. Cool. I'm just gonna go to the next slide. If there's any other questions, feel free to keep dropping them. So as with our last webinar, the first one, and with this one, because you attended, we want to increase accessibility to pelvic health therapy, whether it be a remote consult, which can be done anywhere, or in-person evaluation if you are in Connecticut. We're just giving you a smidge of a discount on that too, to also decrease the barrier. If you want to book, you can scan this QR code and you can do it online. If it's easier, we have our scheduling wizard. Her name is Christina. You can also email her too and just let her know webinar, and she will make sure that everything gets taken care of for you. Again, this can be remote, this can be in person. If you just want to start your journey to like pelvic health and pelvic health therapy, this is the way you could potentially do it. And then here's just a follow-up of future upcoming chat. So our next chat is going to be June 13th. It's going to be with Sharon, Dr. Sharon, who did last talk, and it's going to be all about male pelvic health. Yes, men have pelvic floors too, and a lot of times they also have a really difficult time getting a diagnosis of like pelvic floor dysfunction, and it's often very much overlooked. So we're going to talk about that. And then in July, Janelle's going to come back and talk about all things pediatric pelvic health, because kiddos also can have stuff too. And so second Tuesday of the month, 7 p.m. If you haven't already signed up, go forth and do that. And that is it from our end. We are so thankful that you guys were able to join us, and we're so grateful for Janelle and for Kailey to spend their time with us for this hour on the second Tuesday of the month. It's been lovely. I learned a lot, and we'll see you guys at the next one.